Hello, my name is Enos and welcome back to my channel. This is Work and Wonder. If this is the first time, please make sure you subscribe to the channel and turn on the notification bell. Anytime I upload a video, you'll be notified and you'll come straight here and take a look at whatever video that I have posted. Today's video is going to be very short and of course it's still under the mental health Osce. So today we are going to continue with our mental health Osce. But before I even go ahead, I am very happy because under the comment section I've had people who are commenting that they've watched my videos and then they've gone to take their Osce and they've passed on their first attempt. Congratulations to you all that watched my videos, and then please keep on sharing and suggesting my videos to other people to also watch once it has been helpful to you. So under the comment section, somebody commented that I should do a video on the evidence-based practice, and today that is basically what I'm going to do. I'm just going to give you an overview. I'm going to give you an overview of the evidence-based practice station in the mental health Osce. So basically the evidence-based practice is one of the silent stations. When we say silent stations, what it basically means is that you don't talk, you don't do any actions. Here you just go in, give you your scenario, you sit down, you write your answers, and then you submit it. So here there is nothing like you demonstrating anything to the examiner. All you need to do is to know your marking criteria, and once you are given your answer sheet to write, you quickly start writing. And this is a 10-minute station, so you have a whooping 10 minutes to finish this particular station. So what happens in the evidence-based practice? Under the evidence-based practice, there are 14 topics that all comes with marking criteria. So they've categorized it into 14, and then under any of these 14 you have to study all, because out of these 14 you'll be given just one. And as you can see on your screen, we have the very first topic, which is the ankle sprain, the second one which is autism spectrum, third which is bedside handover, cervical screening, cranberry juice and UTI, dementia and music, diabetes, we have female MI symptoms or female myocardial infarction, or female myocardial symptoms, we have fever in children, we have pressure ulcer prevention, we have restraint, we have saline versus tap water, we have smoke cessation, we have honey dressing for venous leg ulcers. So basically these are the 14 topics that all comes with a marking criteria. When you go on the NMC website, you can download the marking criteria for the mental health Osce. It is there, and then you can take a look at the marking criteria. The reason why I have repeatedly mentioned the marking criteria is because if you know your marking criteria for this particular station, trust me, it will be very simple for you. So on the exams is all about they picking one of these topics, then they will give you a scenario around the topic, and they are also going to give you an article which you will have some form of evidence in it, and out of this you will write your answers using the marking criteria as the framework. So for example, for the ankle sprain, for instance, they can say that a patient came in with ankle sprain, and then the patient is on, let's say, paracetamol, but the patient is requesting for brufen, and then the patient is telling you that he or she heard that brufen works better than paracetamol. So that could be the scenario, and then they are going to give you an article, and the article is going to talk about paracetamol and brufen. It might suggest that brufen can be used in this situation. Paracetamol is also good for this situation, but probably there are no differences in terms of how they are used in the management of pain, but then probably doctors like prescribing brufen for this type of pain and then paracetamol for this type of pain. So the article is going to be very explicit. It's going to give you all the evidences that you need, and then using your marking criteria, you can pick the evidence from that article that has been given you, and then you are able to carve your answers out of the article. The purpose of this evidence base is that we know very well that nursing itself is evidence-based practice. Everything we do in nursing, there is some form of evidence that backs it. So for example, if my patient has headache and I'm going to give paracetamol, why am I giving the paracetamol? I'm giving the paracetamol because it's an analgesic and the patient has pain, and paracetamol has been proved to be very potent when it comes to pain management. People who have pain have taken it and it has been able to help with pain. That is a form of what evidence. So nursing in general is evidence-based. So that is why they are testing your knowledge on these. And then they normally give you the articles for you to be able to pick those evidences from the article, and then you will use that to draw or to write your answers. And here you normally write, or you are supposed to write your answers in bullet point. So you can either put a dash or you put a dot, and then you begin to write your answer. So if they say that Mr. ABCD says paracetamol thinks paracetamol is more potent than maybe brufen, then in the article, once you are able to locate the evidences, you now say that I will tell Mr. ABCD that, I will tell Mr. BBCC that there is a documentation or there is a research that says that ABCD. So basically, it is the evidences that you find in the article that you will use that to explain to whoever is asking you the questions as per the scenario. So it's as very simple as that. Know your marking criteria. When they give you the article, make sure you read the article and understand the article, and you are able to locate exactly where the evidences are. When you read the marking criteria will give you specifically what you are looking for in the marking criteria. For example, in let's say in the case of cervical screening, in the marking criteria you can see something like you should tell or let the person know that the human papilloma virus is the cause of what cervical cancers. And then in the article there's surely going to be a portion of it which states that HPV virus is the cause of what cervical cancer, and then you locate that and then you use that or you write that one as part of your answers. It's as simple as that. In my subsequent videos, what I'll intend doing is that I'm going to pick them topic after topic, and then I just give a scenario, and when I give the scenario, I will just give you the answers or how you write your answers, so that it will be very simple for you. So basically that is all about the evidence-based practice. 10 minutes is a silent station. You sit, write your answers, submit your answers to your examiner, and then your examiner marks it. As simple as that. Before I go, I've had people who are requesting for the materials that I use. As I said, we all know that there are no materials of mental health nursing aside the mock that you can find on the various centers website or on the NMC website. You don't really find materials out there. So basically what I'm doing is that I'm trying to put together some materials from different sources that I have read, and at the end, when I am able to come out with something like a small book, and then I'll put the link in the description. You just click on it and then you can have access to that. I'm not yet done with it. That is why those that have sent me email requesting for the soft copies, I've not been able to provide that. I am still working tirelessly and hardly to get that one out. So just be patient with me, and in some few weeks time, at particular scenarios and all the the scenarios and all the papers or all the documents that I use, I'll make it available to you. So basically that has been the video. My name is Enos and this is Work and Wonder. See you in my next video, and please make sure you subscribe to the channel and share to others for others to also see my video. Until I see you in my next video, it is a bye for now.